Hey everyone, welcome back to my channel. I'm Dr. Melinda Ring, an integrative culinary medicine doctor, and I like to talk about everything health and wellness. And today I want to focus on hormones. There was a big article in the New York Times called Misled about menopause, and I 100% agree with this. I've been recommending the use of hormones for menopause for several decades now for my women. I use them myself. And so I just want to dispel some myths and give you my take on who should use hormones and why. So let's just start off by saying menopause is natural. It is a normal biological process that happens when a woman is on average around 51 years old. It occurs when a woman's ovaries stop producing eggs, and then we have cessation of normal menstrual cycles. Those changes in the hormones can be associated with a lot of symptoms. There are 34 classic symptoms, but the most common ones we hear about are hot flashes, night sweats. Those are known as vasomotor symptoms, sleep issues, which of course then causes fatigue, mood swings, menofog, difficulty with memory, and then a whole host of other symptoms too. What I am a strong advocate of is the use of bioidentical hormones for these menopausal symptoms. And I'll tell you that when I first started to prescribe bioidentical hormones a few decades ago, I got some calls from our local gynecologist saying, "What are you doing? There's no difference between bioidentical hormones and the hormones that were on the market at that point." And now the tune has changed. I will give you my definition of bioidentical hormones because I think there's a little confusion about that. To me, when we're talking about bioidentical hormones, we are talking about hormones that are identical in chemical structure to the hormones your body naturally makes. So, for example, estradiol, progesterone, these are hormones that your ovaries normally produce and that are found in bioidentical hormones. This is in contrast to synthetic hormones. And synthetic hormones work like our body's natural hormones, but they're different in the chemical structure. The reason that's important is because that relates then to possible side effects and possible risks that we don't see as much when we use the bioidentical form. Now, a few decades ago, when bioidentical hormones became popular, in part because of people like Suzanne Summers and others who were promoting their use, at that point, there were no FDA-approved bioidentical hormones on the market. So a doctor needed to prescribe them through a compounding pharmacy. A compounding pharmacy is a pharmacy where I would send a prescription. I say exactly what I want it to be, how I want a woman to use it. They mix it up for the woman, give it to her, and then she takes it and I monitor her use. As opposed to what we're used to, which is let's go to our local CVS or Walgreens, give them our prescription, they dispense it from a little pill dispenser or a box or something. Those are the more typical FDA-approved versions. Now, a few decades ago, again, I could only prescribe bioidentical hormones by ordering them through a compounding pharmacy. In the past several decades, pharmaceutical companies have really started to come out with a lot of different versions of bioidentical hormones that can be used. For example, you can get an estradiol patch or an estradiol spray or a vaginal ring that has bioidentical estradiol or a gel. And you can get progesterone in a vaginal form or you can get it in a pill form. So now I feel like we're in a really good place where it doesn't have to be either FDA-approved synthetic or compounded bioidentical. I personally recommend not focusing on the synthetic forms of hormones and instead looking at bioidentical hormones and whether they should be FDA-approved form or bioidentical from a compounding. So let's talk about what are some of the benefits and downsides of each of these different approaches, compounded or FDA approved. The benefits of the FDA approved are they're more likely to get covered by insurance. They're a little easier to get because you can get them readily at your usual pharmacies. They are FDA approved, so they're more regulated. And one of the big things that I find for my women is that they're more convenient. So when we're talking about a bioidentical cream, you might have to apply that once or twice a day to have steady state levels, versus a patch where you can put it on once a week, take it off, put on a new one. So it's lower maintenance. Now, what about the other flip side? What are some of the benefits of the compounded form of bioidentical hormones? Number one, get rid of allergens, get rid of toxic ingredients that we don't really want. Number two, you can individualize the dose. There is a good variety of doses in the FDA forms, but some women who need a dose of the estrogen or progesterone that doesn't quite fit what's available. We can also prescribe something like testosterone for women, which is not available in an FDA-approved form. There are some nice things about both forms as the years have gone on, and there are more FDA-approved forms. I've been leaning more into that, but I use both with my women. Now let's talk about the guidelines for using hormones. The North American Menopause Society, or NAMS, comes out with a position statement every 5 years. So the most recent one was just in the summer of 2022. It was pretty similar to the one that had come out 5 years before. So it says this: if you are a woman at average risk and you are within 10 years of menopause is when you've had no period for a year, and less than age 60, then the benefits outweigh the risks for using hormones. This is especially true for a woman who has symptoms related to menopause. And while it's not recommended that a woman use hormones for a preventive kind of optimal aging strategy, there are some benefits beyond just minimizing hot flashes and night sweats. So for example, women who use hormones in menopause are less likely to have diabetes. They're less likely to break bones. They're less likely to develop colon cancer. They're protected from heart disease if they start it during that time window close to the time of menopause. Now, what about the risks? Like anything, there is a risk of using hormones, and the number one risk that women worry about is the risk of breast cancer. If we look at the data, though, particularly for bioidentical forms of the hormones, the increased risk of breast cancer with the use of hormones compared to a woman who doesn't use hormones is less than a woman who's obese, less than a woman who's sedentary, less than a woman who has 2 alcohol drinks a day. So I think we need to put this in perspective that there is a small increased risk over time using hormones. However, lifestyle far trumps that. Let's answer 2 more things. 1, do you need to test your hormones to use hormones? Most medical doctors will not test hormones. They'll go by your symptoms and, frankly, the fact that you've had no period for a year. I will say that in my practice, I do like to test hormones. I already know the estrogen and progesterone are going to be low, but I like to know what about those supporting hormones like testosterone and DHEA and pregnenolone. I like to know how the hormones are being metabolized. Are they going down more beneficial pathways? From my perspective as an integrative functional medicine doctor, I do like to monitor hormones. Most of the time, gynecologists and primary care doctors will not be doing that. The last thing I want to address is how long should you use hormones? So the conventional wisdom a decade ago was use hormones for the shortest period of time at the lowest dose possible. That did a lot of disservice to women who were told by their doctors, you've been on hormones for 3 years, time to stop them. They would stop them, start having symptoms again, not feel great, and really based on not good data. So the current guidelines state that the duration of use for a woman should be individualized depending on her personal risks, benefits, and goals. So I think, again, working with your doctor to say, like, when is the right time, or should you just stay on hormones at a lower dose than you might have needed at the beginning, but at a place that makes you feel good? Ultimately, we have to remember that women, we are not We are not a number on a piece of paper. We should think about our quality of life. If you are in perimenopause, in menopause, within that window of time, please go talk to your doctor about hormones and whether they're right for you. Thanks for spending time with me. You'll see a link to another video that YouTube's chosen for you. Please subscribe to my channel. I'm putting out lots of information about everything integrative, especially related to my favorite topics of hormone, nutrition, and inflammation. So I'll see you next time.